Kenny Karczewski refused to believe open heart surgery was his only option. How his search for a second opinion right here at the health system led him to a far less invasive solution. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. And speaking of hearts, take a moment and listen to this heartbeat. You can hear the lub-dub, lub-dub. It's the two beats of a healthy heart. Kenny Karczewski's heart doesn't sound like that. He has something called a murmur. Kenny's heart sounds something like this. You can hear the difference. When Kenny first went to the doctor at another place, not here at the health system, he was told he needed open heart surgery. He didn't like the sounds of that, thought he should probably get a second opinion. So Kenny came here to the health system, and it's a good thing he did because he wound up undergoing a far less invasive procedure with the help of a robot.
Kenny Karczewski was stunned when doctors not affiliated with the University of Kansas health system gave him some startling news.
They told me that, yes, I would need open heart surgery and possibly, based on my body size, body mass and all that, probably a couple of bypasses.
Not only that, but Kenny says those same doctors said he would likely need a heart transplant.
And I quickly said, well, I'm going to probably need a second opinion on that before somebody cracks me open.
It's a good thing he got one, because that second opinion that he got right here at the health system ultimately led to a fantastic change in diagnosis.
I was not in need of a bypass or anything. It turns out, shockingly enough, that my arteries were not clogged.
And that heart transplant, also unnecessary. Kenny says doctors here at the health system proposed fixing him with a special robot. No cutting him open, and he'd be home within a few days. To that, Kenny said he was all in.
He's gonna sew.
Kenny Karczewski joins us this morning here in the studio. You look fantastic.
That video is motivation, I'm telling you. You need to send it to me so I can copy and play it all the time, because I don't want to look like that again.
I thought you looked pretty good then, and you say you've lost how many pounds now?
At least 20 or 25 since that video took place.
Wow.
Yeah.
We're going to get to your whole journey in a minute. We are also joined by thoracic surgeon Dr. Omar Al-Maghrabi. Dr. Al-Maghrabi didn't treat Kenny for this, but you do perform this kind of surgery all the time. So we're going to dig into the procedure and the robotics. You're feeling amazing. Is that
really good.
Because of lifestyle changes you've made?
I have made some. I mean, I haven't been perfect, but for the most part, follow their advice, and it's amazing transition and how much better you feel.
What's the biggest change you think you've made?
Oh, exercise. Yeah. Mm-hmm. And some things on diet. A lot of things on, I just try not to eat certain things at all. There's just no reason. I still drink occasionally. That's probably the worst thing I do, and he would probably say you should never do. And I understand, but I still do that. Unfortunately, I have bad influence of friends sometimes.
Are your friends watching?
Yeah, they're probably watching, yeah.
They're going to tease you for that.
Yeah.
Kenny, you were diagnosed with a hereditary heart murmur. When were you diagnosed for the heart murmur?
2018, 2019. It was faint. And then 19 started knocking, and then you guys know what happened with COVID.
Right.
COVID come around, and honestly, I dismissed it. I'm like, it wasn't important to them, so I felt like I'm good. It's not important to me. And then 2021, 2022, they're like, hey, that's kind of knocking. Mm-hmm. You might want to go see someone. And then once again, getting back in from COVID and all that, it's hard to get in to see anyone, get back on that. So by the time 2023 came around, that's when it really was like, hey, you need to have some tests done.
Yeah.
Yeah, you got a problem. Yeah.
Dr. Al-Maghrabi.
And I didn't really know. That's so, I dismissed it because I was out of shape. That's all I thought.
You just thought it was normal age.
Yeah.
Aches and pains that come with just living.
Stubborn male.
So a lot of people are stubborn, not just guys. Yeah. But I get that. Dr. Al-Maghrabi, what happens inside the heart when there's a murmur?
Yeah, great question. First of all, good morning. Thank you for having me on the show. And Kenny, I must say, you look great. So to answer your question, there are a lot of benign murmurs, and some of them may never cause any issues at all. but some may. And in his case, his was a leaky valve that was causing the murmur, and it had to be addressed.
And we have some video we want to show people
Right.
of a murmur, and that's from the American Heart Association, how you can hear the difference. You can live a normal life with a murmur if it's benign?
Right. It depends on what caused it to begin with. But if we're talking specifically, about the mitral valve itself, and if we're talking about a leaky valve, typically, yeah, people can go years and years without having any symptoms, but eventually it will lead to enlarged heart and other symptoms such as fluid overload, shortness of breath, and eventually heart, failure and sudden cardiac death, which is
Obviously,
huge, right?
the worst. Kenny, you told us you missed a lot of your regular appointments. Like so many people watching during COVID, I put off dozens of appointments, eye appointments. I didn't go to the dentist because I was worried. Was that you?
A lot of it, and a lot of people that work with me the same way, and now I'm a big advocate for get those doctor's appointments scheduled, make sure you do your physical. I have always been a physical guy, so I'm like, you might as well get, usually we know what, you look in the mirror, you know what you've done to yourself, so it's, you go to the doctor, they're just going to tell you, it's all good. But for that regard, but some of the other stuff that you don't follow through with, it's stubbornness that you just need to get past.
You have a large group of friends. Have you made any headway convincing those guys to go to their appointments?
Oh, yeah. COVID was the good and bad of COVID. I think that's the good side because there's less doctors to go to with the overabundance, and so it's driven people to get to their appointments and get some diagnosis from whoever it is they're going to go with.
Figure out what's happening inside your body.
Yeah.
I want to talk a little bit more about the leaking mitral valve. Is the leak, Dr. Almograbi, what causes the murmur, or does the murmur cause the leak?
So you hear the murmur because of the leak. So when you hear an additional sound to the heart, abnormal sound, then you kind of investigate and try to figure out where that is coming from. And once you do further diagnostic workup and realize that it is a mitral valve that is causing it, then you may have to do something about it. All depends on the severity of the leak. Like I said, it's kind of underdiagnosed, actually, mitral valve leakage, and a lot of people have it. And when we look at it, we characterize it as, is it mild, or is it moderate, or is it a severe leak? And a lot of people have mild to moderate leak and may never have any symptoms and may never need any operation or intervention.
A lot of people watching without medical degrees might not even know what a mitral valve is, where is it? So I'd love to take this illustration we have and talk about the mitral valve. What is it? What does it do? And what's the risk of leaving this valve leak untreated?
Very good. So the mitral valve is the third valve in the heart. It's on in the left side of the heart. It separates the upper chamber from the lower chamber, and it functions as a one-way valve. Blood is supposed to move from the upper chamber towards the lower chamber, and the lower chamber is the main pump of the heart. When you have a leak, what that means is blood is flowing backwards towards the upper chamber, and that causes recirculation and inefficiency, which leads to enlarged heart, arrhythmias, palpitation, fluid overload, shortness of breath, lower extremity swelling, and so on, but eventually will lead you towards heart failure and, like I said, sudden cardiac death if it doesn't get treated.
Kenny, were you having symptoms?
I could walk up several flights of stairs, not run out of breath, but I could walk around my car and it would be out of breath. So it was just so, you never knew when it was and I just dismissed it as, once again, just one of those things.
Life.
And the other thing is that he brought up fluids in both my legs. That's all gone away since I had this repaired.
So you had swelling in your legs?
Oh, yeah. But I didn't really notice to the effect until after this got repaired, and I got, 6 weeks of recovery, and I'm like, whoa.
Legs look skinny.
my feet look different. Yeah.
Kenny, you received two very different recommendations. In the first place, you were told you needed open heart surgery, possibly even a heart transplant?
They said if I didn't go through with certain things, I could end up needing a heart transplant. And I'm like, and like I was telling you guys earlier, I just didn't have a very good feel of what I was being told. And that led me to go and immediately get over here to KU Med and get a second opinion.
So your gut told you this doesn't, really?
It did,
you felt it that strongly?
I did, yeah.
Wow.
I mean, my wife, when I get in the car and my wife gives me a rash of crap because the cardiologist had already called her and told her all the things that need to happen to me.
Right.
And I'm just like, whoa, 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 slow down. We're not doing any of this. And nobody's getting in here without, let's first, make sure what we really got to do.
Because that's a huge surgery, cutting
I haven't
open
heard
your
anybody
sternum.
saying that was fun.
Right.
Yeah, not that this was fun either, but.
But that is no fun.
That's no.
So
Yeah.
what about Kenny's condition, or what the situation going on with Kenny's heart allowed him to have a robotic surgery?
Right, so many factors go into selecting the right patient for the robotic approach. And when we look at the mitral valve, we look at the cause of the leak. The mitral valve is comprised of two flaps. One is called the anterior leaflet, the other one is called the posterior leaflet. And typically we select patients who have posterior pathology or an issue with the posterior leaflet. And those are the typical patients that we offer the robotic approach to.
So looking at Kenny, it was clear he didn't need his sternum cut open.
Correct, correct.
We have some really good video of what the procedure looks like. Now, this isn't Kenny having the robotic procedure performed on him, but this is what it looks like in the surgery room. Someone undergoing the same procedure as Kenny with the help of a robot. What are we looking at here, Dr. Almagrabi?
So we're using the Da Vinci platform, and it's a master-slave type of platform where it doesn't really do anything without the surgeon moving it. So the surgeon sits at the console, the surgical console there, and he controls the arms of the robot. And what the robot offers is better visualization. It's a high definition, kind of a 3D image, actually better than the naked eye. You can see a lot better. And it also makes your dexterity better and precision better. So it makes a good surgeon, look even better.
It's not something, when people hear robot and they're not trained as thoracic surgeons, sometimes you think the robot is like beep, boop, going on its own. You've programmed it and it's going off into Kenny's heart, but you're controlling every single move of the robotic arms.
Absolutely. Actually, when I first saw the robot, I was disappointed because I thought it was going to be an actual robot and make that noise, but it is not at all. Like I said, it's a master-slave platform, so it does not move on its own. We move it, and it turns into a real-time movement of the robotic arms.
The procedure's always been safe when you do this. What do you like best about using the robotic procedure, the robotic method?
I love the visualization and the fact that it makes every movement more precise. But also the mitral valve is a posterior structure. It's just really in the back of the heart. And when you approach it from the sternum, it's sometimes really hard to see. And so when you come from the side, you can just directly look at it and evaluate it and figure out what's wrong with it and fix it.
It's fascinating.
Yeah.
What's it like looking at the video? It was someone else undergoing the procedure.
I wouldn't watch the video before I had the procedure. Some of my friends did. They're like, oh my God, that's going to be interesting. I'm like, stop talking. I really don't. I got enough to worry about. But I did watch it. It is amazing.
Of how it works.
Thank God for modern day technology.
Right?
Absolutely.
Yeah.
We have so many questions coming in from our viewers. If you have a question, you can send it to us on YouTube, Facebook, the All Things Heart email. You can connect with us in real time. We will take your questions and your comments by going to those links right there on your screen. Kenny, what made you come here to the health system for a second opinion?
Just my gut, really. I mean, it's just thinking about everything that, knowing people, what they've been through, and there's got to be a different way, or hopefully that's not what I have to happen. And
did you know other patients? Do you have friends that have come here?
I've got a lot of elderly friends that have been through heart procedures, and some of theirs, they said a year or better, and they weren't feeling better. And those are guys that are in shape, who play sports and everything else. So I'm like, I'm not in shape. This could be bad. So no, it did. I knew people at KU anyway, and it didn't hurt to make a call.
Right.
Sometimes you worry about offending someone. When it comes to your health, don't ever worry about offending anyone, because it's your body, not somebody else's. So
better to offend someone, and they wouldn't be offended, rather than take a risk on your heart.
Yeah, or anything for that matter.
Right.
There's nothing wrong with second opinion. I would recommend it almost all the time, especially in a case of a heart or anything else that's a major organ in your body.
Especially now, after what you've experienced. Dr. Almograbi, what's the recovery time for this specific procedure?
So for the robotic approach, we typically nowadays remove the breathing tube in the operating room. And then most patients spend one night in the ICU and about 2 to 3 more days on a regular nursing floor. So typically they're home by day 3 or 4. And then it takes a couple of weeks to maybe maximum of 6 weeks before full recovery is achieved.
Kenny, what was it like for you?
It's about 6 weeks to where I was.
Till you were full recovery?
I was doing more than what I was doing before I had the heart surgery. So really it was even better than that. But no, that's thanks to them, and putting in the work.
Yeah.
But
And how long were you in the hospital at the health system?
I was there 4 days, and no fault of theirs. I just kind of like slid under because it was a weekend thing, and I think they just, the rounds, they forgot about me, so to speak.
Yeah, I'm sure they didn't
After
forget
I
about
put myself
you.
in the shower because I couldn't stand myself, I think they wanted me. They're like, he wants to go home,
Right.
and I did. Yeah.
Right, you got out of here.
Yeah.
With open heart surgery, obviously you're cutting open the sternum, cracking it open. I'm sure you don't use the phrase cracking it open. Where are you going in? Maybe you do, but not on camera. No, where are you going in? Are you going in through the abdomen when you're using the robotic procedure?
Yeah. So when we do the robotic approach, we make an incision in the right groin so that way we can connect to the heart-lung bypass machine using the femoral artery and vein.
Okay.
And then we use multiple stab incisions on the right side of the chest. And that's how we insert our robotic arms, camera, and one of our kind of surgical port so that way we can remove and take out instruments and such.
Is that the surgeon's hands
Yes.
steering the...
So this is the surgeon controlling the arms of the robot real time, and you can see it translate there.
Look at how clear those images are. If you were looking at that just eyeball to the area, how do you even find what you're looking? In the olden days, how would you find what you're looking for? You were saying you'd have to go to the back of the heart for that?
So the sternal approach is a great approach too. Don't get me wrong. We do a lot of it too, and not everybody is a robotic candidate. And it's a little more difficult to visualize the valve from the top because it's a posterior structure.
Right.
So you have to do a lot of maneuvers to kind of bring it back into visualization so you can work on it. But still, the sternal approach is a very well procedure, and people do really well.
Safe.
And it's very safe, and people do well from it too. So.
Because we have had guests on our program who've had their sternum open and things happen, and they recover remarkably from that as well.
Yeah, it's always a surprise to me how well people do from a sternal cracking approach. But yeah, no, people tolerate it really well.
Does a lot of the recovery in Kenny's case and in anyone's case have to do with how well the patient takes an active role in their own recovery?
100%. It's a teamwork, a team effort. We do our part. We expect the patient to do their part as well, because if they don't, then it's not going to work out for either one of us. So we always emphasize before patients go home that you need to do this and do that and avoid doing this. And if you have any questions or concerns, please call.
How long has this procedure been available? The Da Vinci, which is the name of the robotic?
Yeah, the Da Vinci
features?
platform received FDA approval for mitral valve repair back in 2002.
And then, so has this procedure then been available since 2002?
Correct.
When you were going through medical school, was this something you trained on?
No, actually, I never heard about it until I started general surgery residency back in 2013. And that's when I was exposed to it.
It's amazing how many of our doctors, because science moves at a warp speed.
Right.
So how do you start studying to do this?
Well, first you need a solid foundation in a regular open approach. You have to be very comfortable in doing it through the sternum or in an approach that is the typical approach. Once you lay down the foundation, once you are comfortable with that, then you start learning more about minimally invasive approaches, robotic approaches, and that's kind of the route that I took. Is I learned how to do it through the regular open approach, and then started doing a lot of training modules. I had great mentors all throughout my training career, and you just learn from just practicing.
Just do it. How common is it to use a robotic device in the surgery room for you?
It's not as common still because we are still selecting patients for the robotic approach, but we are doing mitral valves. We're doing single vessel bypass surgery as well with the robot. So there are few applications for it, but not often.
We're getting some questions from our viewers, and we also have some pre-submitted questions. Yen Liang has a question. Yen, I'm going to paraphrase this because it's a very long question. I hope I get it right. Yen Liang wants to know, why is low diastolic blood pressure related to aortic valve insufficiency? Also, he writes, I've heard it's now possible to replace the aortic valve through a catheter procedure instead of traditional open heart surgery. Let's start with the first one. Why is low diastolic pressure related to the aortic valve insufficiency?
All right, so the aortic valve is a different valve now. So we were talking about the mitral valve. The aortic valve is the fourth valve of the heart. It separates the main pump of the heart from the aorta. Aorta is a big blood vessel. And so blood moves from the lower chamber into the aorta, and the aortic valve function as a one-way valve. Once again, blood moves forward. So when you have insufficiency or regurgitation, that means blood is moving backwards. And when we measure systolic and diastolic blood pressure, we're looking at the blood pressure or the pressure within that blood vessel. And when you have a leakage, that means blood is going backwards. And so the vessel is emptying out quicker, and that brings down your diastolic number.
His second question is it possible to replace the aortic valve, this is a different valve than what we're talking about with Kenny, through catheter instead of traditional open heart surgery?
100%. 100%. We call it a TAVR procedure, and we are a very busy center when it comes to TAVR numbers, and we do a lot of it. But we have to go through the process of making sure that you qualify for it. So we have a valve clinic here. You get seen by a cardiac surgeon, by a cardiologist, a structural cardiologist, and we'll both look at all your studies and figure out if you need more diagnostic workup or not. And then that will determine whether you're a TAVR candidate or not.
Do you have to remove the old valve before placing the new one?
If you're doing it percutaneously, no. You just literally kind of balloon dilate the new valve and spread open the old valve.
Oh, interesting. So those are questions from Yen Liang, who always asks really good questions. Jeremy Yenser has a great question. He wants to know, if the machine is repeating what you're doing, what are the benefits that make using the robot better? How is it better than doing the surgery manually? Now, he's using the word better, but I did hear you say there's no better. There's just candidates for one and candidates for the other.
Right. So the robot, what it gives me an advantage of being able to visualize the valve better. Like I say, when you put your eyes in those camera lenses, it's a high definition 3D picture, and it also magnifies it, and it makes it look so much better. I
mean, look at that.
Exactly. So you'll see a lot better, and once again, it gives you better dexterity and make you more precise.
And Becca wants to know, can you go into a little bit more specifically what makes someone a good candidate for the actual open heart procedure?
Through the sternum?
Yeah.
Well, it depends on your surgeon too, and what they're comfortable doing for you. But really all depends on the pathology of the mitral valve. If it's only isolated to one flap, and more specifically the posterior flap, and then you can approach it with the robot versus the sternum. You have two ways you can go about it. We also do it percutaneously too, transcatheter. That's another option, so that would be a third option that we offer here at KU.
Lisa has a question. Lisa wants to know, this is a great one, what do you see for the future of robotic devices in heart surgeries, but also in the medical field?
I think the future is going to be bright. Right now we're just repairing valves robotically, but we're hoping that we can start replacing valves robotically. We're hoping that we can do bypass surgery robotically and avoid opening up the sternum.
Julie wants to know if you can do more procedures in a specific time frame with robotic assisted devices. Does this make it quicker?
There's a huge learning curve from the robot, so initially it's not as quick and it takes a lot longer because you have to have a team that is also trained on using the robot and changing the instruments for you. But once you have a lot of experience, you've done a lot of them, eventually it doesn't save time, but it's almost the same time frame as if you were doing it in an open sternal approach.
Corey has a question for Kenny. Corey wants to know if you had any apprehensions when you heard the word robot or robotic.
Not really, actually, because I did see where it's been out for quite a while.
Right.
I didn't see where it was 2002, but I knew it'd been out at least 20 years. And so I do believe in modern day stuff.
Sure.
Especially with even the youth of doctors, because they bring a different approach. And so I felt pretty comfortable about that, and even more comfortable that I was not going to have to be my sternum opened up.
Right, or possible heart transplant.
Yeah.
I mean, you got a very scary news delivered to you at one place, and then you come here and it's a big deal, but it's not as frightening as frightened as you felt.
And something I forgot that I had mentioned before in our last segment, but they did assume that my arteries were clogged based on my body mass index.
The other place.
And so they were assuming that they were going to do bypass surgery and fix my valve at the same time. So when I came here to KU, not only did I get a quick examination from the heart valve doctors, I also got my heart cath done, and that's the other thing that made me where I could do the robot is essentially they were clean, which I was shocked, don't get me wrong.
From the way you were living?
For my lifestyle,
Man, I'd like to hang out with you just for an hour, and however you were living. It must have been fun.
I used to entertain a lot of customers, and yeah, I haven't been that gentle to my body. I'll just say that.
You really look amazing. So whatever you're doing,
sweet. That's nice.
You're following orders.
I am better orders, yes.
Julie has an interesting.
My wife would disagree.
Oh, she would? We should have had her on here.
No.
June has one more question. June wants to know, this is interesting, what would happen if the robot, she writes, broke down during a procedure? Would you be able to take over manually, or would you need to stop and reschedule?
No, so we just undock the robot, remove the arms, and then we just do it manually.
So it's fine.
It's fine. Yeah, no, we're in total control of the robot. So if it stops moving, like if we're moving our arms and it's not translating, then we just back out. Yeah, take over, just undock the robot, push it away.
And that's why you said earlier in the discussion that you had to be totally comfortable and trained in open heart,
right,
and in knowing what you were doing before you can take this step.
Exactly, because if something were to go wrong with the robotic approach, you'll have to convert to the sternal approach. And so you have to be very comfortable with the sternal approach first before you start learning advanced, minimally invasive approaches.
I really never and it's a great question, June, I've never heard of anything breaking down in the middle of a surgery so it's a good question that we had, but it doesn't happen.
It has happened, but very, very rarely, and it's usually one arm or an instrument breaks down and we just switch it out.
Okay.
Yeah, but to the point where we actually had to undock and remove the robot. It hasn't happened to me, but it could.
You're ready for it.
We are ready for it.
It's not.
It was brought up in my consultation by Dr. Deon.
Yeah.
I'm like, well, that'd be interesting. He goes,
ready.
Well, we have control though.
Right.
To his point.
And you have trained surgeons who know what they're doing either way. This discussion is so fascinating. I'd love to get some final thoughts from both of you as we wrap this up. Kenny, what would you like people watching to know?
Just make sure you go and get your test done. Get a physical, male, especially men. Men are worse than women. Women tend to follow the rules more than we do. But yeah, I would say definitely, get tested. Make sure you do your physicals every year, and just follow your gut in a lot of cases, and listen to people in your network. And if you're around some knuckleheads, get away from them.
Get away from them.
Yeah, get away from them. Get around some good people. Yeah. They'll line you right.
I heard an expression: you become most like the 5 people you hang out with the most.
Yeah, there's a lot of truth in that. Yeah.
But you say you're still converting your old buddies.
Oh,
your Fab Five.
I got some.
You brought them over with you.
I got a close-knit group of guys, and
That's good. That's a good message.
It is funny how it gets smaller as you get older.
Right.
Unfortunately.
I find you sometimes are just down to one pet. The older you get, you hang out with them. Dr. Al-Maghrabi, what would be your message to our viewers?
Just advocate for your own health. Seek out a second opinion if you're not happy. Trust your gut feeling, like Kenny did, and go to a center that offers multiple options, and go to a valve centered center where you get seen by a structural cardiologist, a cardiac surgeon, and get multiple opinions and multiple evaluations.
And that's here. That's what happened here.
Exactly.
It was amazing. It really, I have to give props where props are. I mean, everybody was on point from the moment I came here for my first test. I was here for almost a day. I mean, I ran through the mill.
Yeah.
And then I came back 3 days later and, had a heart cath and some other things done. And I mean, we knew everything by the end of that week, what we were doing.
Boy, that must have felt good.
It did feel good, yeah. Because it was an orchestrated plan.
Right.
And, that's what you want to have happen, when you're thinking about your health and what you got to go through.
You want to look around and think, these people are all here
they
for
got
me.
It together. They got it together. Yeah.
They got it going on.
I don't care if they had it just for me. They just had it together.
Thank goodness.
Yes.
Well, thank you for joining us and sharing your journey.
You're
going to help a lot of people watching.
I hope so. Yeah.
Help get a lot of husbands to the doctor and a lot of wives too. Women can be stubborn too. Not that I'd know anything about that. But it's a great message, and thank you, Doctor, for making time. We know you're super busy.
Thank you.
Thanks for joining the discussion this morning. If you would like to watch or share any of our past episodes, just scan the QR code on your screen right now. That will take you to a page with links to all of our programs that you can watch and share and enjoy. Coming up next week on All Things Heart, feeling jittery and nervous for no good reason, this man knew that something was physically wrong. While his diagnosis was common, his solution would be a first. That's next Thursday at 8 a.m. Coming up on the Morning Medical Update. When a stroke leaves your hands and arms weak, simply getting dressed can be a challenge. Now there's a new way to rewire the brain and rebuild confidence. I'm Alexis Del Cid. On the next Morning Medical Update, this special implant that boosts the power of rehab. Learn who may benefit from a first-in-the-region option for stroke survivors. That's Friday at 8 a.m.